Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about what positions new medical coders should apply for. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got a comment and I'm going to read the comment and we're going to get into it. So here we go. All right, so the viewer says, how do we make an objective statement if we aren't sure what position we want since we have no experience in inpatient or outpatient or pro-fee coding or professional fee coding? I'm not sure what I would even want to pursue yet. So the viewer commented on resume tips for new medical coders with no experience. So here's the thing, guys. I know there's a lot of different titles, there's a lot of different just names that medical coders fall under. So it's really kind of difficult sometimes to know, can I apply for this one? Do I qualify for this one? How do I know where I want to go? So the goal of being a brand new medical coder, of course, is to get in. You want to get in wherever you can. And you want to find a position that is going to give you lots of experience in lots of different places as much as possible. Meaning that you're going to have to exercise your ability to diagnosis code, to procedure code, and to evaluation and management code. And typically that is in the job listing, but sometimes it's not. Sometimes it's very general. So you'll see that it'll say candidate must know ICD-10, CM, CPT, HCPCS, and sometimes if it's an inpatient position, it'll say must know ICD-10 PCS. All right. And then sometimes you'll see this is a professional fee coder position, coder whatever, coder 1, coder 2. The coder 1, coder 2, coder 3 things are different everywhere, which is why I haven't really done a video about specifically what does it mean when it's when the position says this is for a coder 1, a coder 2, or a coder 3. I've seen coder 1 for different positions or different facilities be just for ER coding and recurrent accounts coding. Okay, so it really just depends on what it means for that particular facility. So again, it goes back to knowing what the wording is in the job listing, so that way do you qualify for this particular position. So again, the name of the game is to get in. And it is going to require you to know when you're looking at these job listings what you're actually looking at. So obviously, if you have one of the 4 main medical coding certifications, all you need is one. The CCS, the gold standard of medical coding credentials, that is a certified coding specialist. The CCA, the certified coding associate, or the CCSP, the certified coding specialist physician based. These are all with the American Health Information Management Association. Or if you have the CPC, the certified professional coder, if you're a brand new certified professional coder apprentice, that is a credential offered with the American Academy of Professional Coders. These are the 4 main credentials that employers are looking for when they're looking for candidates to do medical coding. Now, if you have the CPC, the CPC-A, or if you have the CCSP, this means that you can only code for the outpatient side. Okay, so this means that you can code for outpatient coding, you can do clinics, you can code for the ER, you can also code for professional fee, because professional fee or pro fee service is covering the CPT book, right? And it falls under, of course, those outpatient rules. So, of course, you have your diagnosis coding as well and your HCPCS. So you can apply for outpatient positions if you have those credentials, all right? Outpatient positions, ER positions, like I said, professional fee, those 2 credentials fall under that because they cover outpatient medical coding. Now, if you have the CCA, the Certified Coding Associate, or you have the CCS, the Certified Coding Specialist, this means with this credential, right? There's one credential. It says that you can code in the outpatient setting. You could, because ICD-10, CM, CPT, and HCPCS, Or you can also code for the inpatient side of the house, which is the facility coding. And that's going to fall under your ICD-10 PCS, all right? Because these ICD-10 PCS codes are going to account for those procedures that are performed in the hospital or the facility. So that's why you want to make sure that you understand the distinction. Now, it doesn't mean that if you have a CPC or a CCSP that you can't apply for those inpatient positions. It just means that those certifications are not testing you on ICD-10 PCS. They are only testing you on ICD-10 CM, CPT, and HCPCS, right? But if in your program you happen to get ICD-10 PCS training, make sure that that is on your list of skills, right? That ICD-10 PCS is on your list of skills, because that means that you have the training, you just didn't get the certification. And for some places, they're okay with that. At my facility, all of the inpatient coders, every last one of them has a CPC. Every last one of them. In my facility currently, I am the only one. I am the only coder who has the CCS credential. Everybody else has either the CPC or they have the CCSP. I am the only one who has the CCS in my hospital. Okay, so that goes to show you there's just a bit of a difference sometimes. And it really all depends on how you are displaying your skills and how you are performing when they're giving you an assessment test, because they will test you. So even if you have this CPC or a CCSP and you want to apply for an inpatient coding position, and let's just say, for example, the facility says, okay, we're going to go ahead and give them a test and see how they do on this test, because they do have the ICD-10 PCS training. Oh, okay, well, they did really good. All right, so they may say, okay, you're fine with this credential that you have, or they may encourage you to get one of the credentials that has, the PCS testing in it, which of course is a CCA or the CCS. Or they may say it's okay to get the CIC, the Certified Inpatient Coder, and that is a credential offered with the American Academy of Professional Coders, okay? But when you're looking at these job listings, you will see oftentimes that they're looking for inpatient coders, that they are looking for the CCA or the CCS certification, okay? It doesn't mean that they're not going to start asking for the CIC someday, more frequently, but it just means that for right now, that is what they're looking for when they're looking for inpatient coders. So again, it really goes back to understanding what you're being taught. It doesn't matter that you don't have experience yet, because we all started with no experience, right? So we had to start somewhere. And with that in mind, that is letting you know, okay, well, if I know what my training says, that I have the ability to be able to code in these different places, this is how you find out where you're going to code for, all right? So those key things you're going to be looking at, or you're going to be putting in your resume, your objective statement in your resume. If you're looking for an outpatient medical coding position, or you're looking for a professional fee coding position, or if you're looking for an inpatient coding position. Now, of course, you're going to have to look at your job listing and see what specifically that title is, and whatever the title is, that's what you want to put into your resume. So that way it can automatically recognize that you understand what position that you are applying for, okay? And I know it's a little bit confusing, but again, if you're looking at the job listings, it's telling you all the answers. It's telling you that candidate must be proficient in CPT coding or professional fee coding, or it is, must know ICD-10 PCS. So just be sure to look at those job listings. I've done reviews before on job listings and what does it mean. So if I remember, I will make sure to put those links in the description box. I don't always remember. So if I didn't, just make sure that you let me know in the comments, and I will get those added on there. But again, you can take a look through all of my videos and check out and see what other ones that I have explaining the job listings, because sometimes the wording in the job listings is a little weird. But if as you go through these positions, you're going to understand. And don't be alarmed if you don't have 100% of the qualities that they are wanting for that particular position. Say, for instance, you are applying for a position. It says they are looking for outpatient medical coders. Must have 3 to 5 years experience, which is, tried and true, right? That they're always saying that. They're saying that they want all these years of experience. You're still going to go ahead and apply anyway. Because if employed medical coders in the area are going to be happy where they are, they're going to stay unless they want to move. Now, even if a veteran coder wants to move, it doesn't necessarily mean that they're going to beat you out of a job. Only because if the person who is doing the hiring is actually looking at what kind of skills are they coming in with. Because somebody could have years of experience only in one particular clinic and not really know a lot about different clinics, where a brand new medical coder coming in with all this new training will know what different rules are for different things, because they just got done learning this. So don't count yourself out. Make sure that you still apply anyway, and study that job listing and put those things in there that's relevant to that job listing. Again, if it's saying that we are hiring for outpatient medical coders, that's something that you want to go ahead and put in. I am seeking an outpatient medical coding position, all right? And those are the things that you can add to your resume to get that kind of, okay, we have somebody here who understands what's going on, so we're going to go ahead and give them an interview, all right? Now, every single interview that you go on is not going to lead you to your forever home, all right? And even if you do get hired, it still doesn't mean that that is your forever home. It just means that's where you're starting. I had to go through 2 other forever homes, or 2 other homes, in order to get to my forever home, okay? So that's something that you all have to think about. I had to bounce around in order to get to mine. And if you start in a position at the beginning of the year, and let's just say 6 months in, you say that this position is really kind of not for you, you want to move on and find something else, that's totally fine. Coders do this all the time. There's nothing wrong with going to another place that's going to give you more of a challenge. Us medical coders in the industry, health information industry, we understand this. There's going to be people who will start in a certain job, let's just say in risk adjustment, okay? I know some people get sensitive when I start talking about risk adjustment, all right, guys? Risk adjustment is 100% diagnosis coding. And for those of you that get so excited about that, like, oh, I know how to do that, so I'll go ahead and just do risk adjustment coding. It can stunt your growth. It can stunt your growth, meaning that you are not doing procedure coding. You're not doing evaluation and management leveling. So again, it's stunting your growth. And if you look at the job listings, there are some job listings that will say if your only experience has been in risk adjustment, they do not count that as experience. So I have always recommended that if you're going to get started in risk adjustment, make it a short stay, not a long term, okay? So that way you can still keep up on your skills, because there's a lot of people who will get started with risk adjustment and stop working on those workbooks, and they will completely lose their ability to procedure code, evaluation and management code, and even apply those modifiers. So you don't want to get stuck there, all right? So again, looking at these, taking the time to look at these job listings is really going to help you. Sometimes you'll see them called health information technicians, right? So you can go ahead and put that into your job listing, into your resume as well, because that's specifically for that particular position. This means that you're going to have to sometimes update your resume very frequently. And when you do that, don't get discouraged about that. It's just part of the process. You don't want to send out a blanket resume to a bunch of people. I've had a couple of people tell me, well, Blue, I've sent out hundreds of resumes. And I said, well, let me see the resume that you were sending out. And they were sending out a very generic resume with not highlighting any of the things that they learned, and it was very poorly written, and that was preventing them from getting calls back. So that's something that you need to be aware of. Resumes are very, very important, and people don't take them seriously because they want to be scared of what do they need to say. Everything that the employer is looking for is in their job listing. And not only that, you can look at other job listings and look in there and see what they're asking for. They're always asking for medical terminology, anatomy, pathophysiology. Those are things that need to go into your resume. Okay? Don't copy from resumes that are out there. There's one floating around that says, oh, NCD, LCD edits. If I see that on somebody's resume, if I'm a hiring manager, that's immediately going to get rejected because I know that they copied that. Well, Blue, you're telling us to write in medical terminology, anatomy, and pathophysiology. Yes, because those are core elements of a medical coder. If I start seeing things on there that's like NCD, LCD edits, again, I know you got that from that resume that's out there floating around for a medical coder example resume, right? And people have asked me before about my resumes, and they say, well, can we see samples? No, because I protect my clients' privacy with their job histories and things. And somebody else asked me, well, can't you just make an example? No, I'm not going to do that, because if I did that, again, that example is going to be copied. No, not going to do that. So guys, that's something that we have to work on. I'm giving you these tips completely free, and I've done so many other videos where I talk specifically about those resume tips. Again, I'll leave them in the description box, the link for the other YouTube videos that I have on those. I'm giving you this advice for free, guys. All right. Now, there are people out there that do write resumes. I'm a resume writer myself. I am not taking any bookings until January of 2023. My rate will go up. That rate will be in the description box below. So if you're interested, then you can go ahead and certainly contact me then and book a session or whatever. So it's entirely up to you. But you get what you pay for. So I want to put that out there. Now, sometimes it's very expensive. People spend a lot of money and they don't get very much out of it either. So really, it all depends on where you go. I do have good feedback left on my LinkedIn page, right? You can find me on LinkedIn, Medical Coding with Blue. And you could check it out if you wish. But again, I'm a medical coder who loves medical coding and I write resumes, and it has gotten people jobs before. So I know a thing or two about what they're looking for. So if you're going to go to a professional resume writer, make sure that it is somebody who knows what they're talking about, not just somebody who's going to give you just a generic template and here you go. And it's just on a good, no. You need to make sure that you are knowing what you're going to get. All right. So that's just my advice anyway. But like I said, know the place that you're going to apply. Know the position that you want to get. Know your skill set. Your skill set is what you were trained in. ICD-10-CM, CPT, HCPCS, or ICD-10 PCS if you have that training. If you don't worry about it. Just put those main 3 on there. All right. And if you did have it, then go ahead and add it. If you had the training, but you weren't really confident in it, and you still ended up getting the CCA or the CCS, you can still list the ICD-10-CM, ICD-10, the CPT, and the HCPCS, and you can leave the PCS off if you do not wish to pursue an inpatient coding position. All right, because sometimes they will look at all the skills that you have listed, and if you don't have that skill listed, then they're going to know that you're not interested in the inpatient coding position. Because sometimes they do hire people who have the CCA or the CCS, to be like a rover to go from outpatient coding to the inpatient coding to help out. So it really all depends on the facility themselves, what they're looking for. So be very mindful about the skills that you're adding to your resume, all right? And make each one of them count. Again, if you put in that annoying NCD, LCD edits, I would reject your resume. And that's just my advice anyway. So that's my message for today. So I'm going to go ahead and wrap this one up. But yes, guys, best of luck to you. Do not get discouraged when you see those 3 to 5 years. They're always going to say that because employers don't want to have to train. But it is your job to make sure that they're going to take a chance. If they're going to take a chance on you, that you are going to make sure that they don't regret them, giving you that chance. So you're going to know that you need to do your research and that looking at all these details is very critical to what we do. All right, guys, and it starts with those job listings. So this is my advice anyway. I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, I hope that you will like, subscribe, and share, and I will see y'all next time. Bye.